Today we're going to talk about drops and glides. In the normal gait cycle, once you heel strike, your foot pronates slightly. Pronation is not a bad thing unless you see it unilaterally instead of bilaterally. So with drops and glides, we measure the sussentaculum tali, and we also measure the navicular tubercle, and we assess on each foot in a seated position and a standing position how much one drops in comparison to the other side. So to assess your drops and glides, you're going to palpate on the foot, you're going to come off the medial malleolus, and you're going to hit the sussentaculum tali. Then you're going to palpate distally until you come across the navicular, and then draw lines in accordance, and you're going to do this on both sides. Then you're going to take a card and put it directly perpendicular to the lines you just drew, and you're going to mark on that card exactly where it goes. You would do this and compare with both sides, and then you would have the patient stand. Now with the patient standing, you're going to reassess. So you're going to check the height of the talus, and then you're going to come up to the navicular, and then draw a perpendicular line. Now keep in mind, the T1 is the first talar height line, and N1 is the first navicular height line. So then, logically, the T2 will be right here where the 60 is, and then the T1 will be right there at the 47. So as you can see in the close-up of the postural stability indicator card, on the right foot, T1, which is measured seated, is around 67 millimeters, and T2, when the patient stands on the right, is 60 millimeters. N1 is 50 seated, and N2 is 46 standing. We're not really concerned about the talar drop as much as we are about navicular drop, and if it's less than 5, we tend to tolerate that better without too much of an intervention unless there's pain. So on the left foot, we have T1 at 64 millimeters seated and T2 at 67 millimeters standing. When we look on the navicular drops, we see that N1 is 57 millimeters seated, and that N2 drops down to 51 millimeters standing. This is where we see a real discrepancy in the navicular drop height on the left foot. In this case, if this caused a lot of pain, we would probably stabilize the ankle with a lateral heel lock to decrease pronation timing and to help raise the navicular and prevent pain. As you can see by the card, the left foot dropped more significantly than the right at the navicular. This would indicate some sort of calcaneal restriction, and you should also assess if the joints are moving properly between any of the bones in the talus, navicular, and tibia. Also, something we could do for this patient is a lateral heel lock tape job, which would slow down the pronation in that foot and decreasing the amount of navicular drop.